Our study is the implementation of twice-daily nursing summaries to improve perceived effectiveness of interdisciplinary communication at an academic medical center. Our project is designed to improve communication between physicians and nursing members of the patient care team. It is our hypothesis that lack of effective communication has the potential for inadequate care, errors, longer length of stay, increasing expenditures, and general dissatisfaction. And we predict that incorporation of an end-of-shift nursing summary may lead to improvement in caretaker satisfaction as well as possible avoidance of some of the aforementioned errors. The methods for our study were to implement for a 3-month period a twice daily end-of-shift summary to be completed by nursing staff. Physicians and nurses were to be surveyed prior to the intervention and as well as after the intervention. And comparison between the two surveys was to be made to ascertain as to whether there was a improvement or a change in general in the perceived effectiveness of communication. After the intervention and the surveys were compared, pre-intervention data showed a significant difference between physicians' and nurses' perceptions of the quality of communication. Among the surveyed physicians, there was a significant improvement in the perception of communication following the intervention. 100% of the physicians, as opposed to 55.6% of the nurses, reported the nursing end-of-shift summaries very useful or extremely useful. There was, however, no significant change in the perception of the surveyed nursing staff following the intervention when compared to before the intervention. There was also, interestingly, no significant change in the perception among the surveyed nurses' interpretation of the appropriateness of the amount of charting required prior to versus after the intervention. Below here you can see some charts that represent the pre-intervention survey answers versus the post-intervention survey answers. On the left, 0 through 7, 0 representing strongly disagree and 7 representing strongly agree on the y-axis, versus on the x-axis you can see the number designations to designate which question is being asked, and the questions that were addressed on these charts are designated on the top right-hand corner. In conclusion to our study, the perception of significant improvement in communication from the point of view of all physicians who participated in the study, and the nursing staff found that the end-of-shift summary was at least very useful, where several of the nursing staff found it extremely useful. All physicians found the study intervention to be extremely useful in improving the communication and general satisfaction of the patient care team from the physician represented. Limitations for our study were the number of participants in the end-of-shift summary, and also we had limited participation in the summary survey. Thank you very much.